For the second part of our video, I will cover the drugs that are used to treat cardiovascular diseases. Cardiovascular medications are taken with strict precaution, and as health providers, it is a good practice to record the patient's blood pressure and heart rate before the use of local anesthetics and prescribing antibiotics that may hinder the effects of their medications. One of the oldest medications given to patients with cardiovascular diseases is digoxin. It is used to treat congestive heart failures and chronic atrial fibrillation. Although digoxin isn't widely used as vasodilator, they are effective in increasing the heart's contractility and in slowing down ventricular response while keeping the patient's heartbeat irregularly fast. Adverse effects of digoxin include palpitations, syncope, vertigo, temporary vision impairment, confusion, nausea, vomiting, and diarrhea. Implications: digoxin is not to be taken with epinephrine and anticholinergics that will result in excitation. In addition, taking antibiotics such as macrolide and tetracycline will be poisonous to the patient under digoxin treatment. Beta blockers are drugs ending with the suffix "lol". These drugs work by inhibiting the action of norepinephrine that will result in lower blood pressure and slower heart rate. Beta blockers such as propranolol are medications given to treat hypertension, angina, stroke, and arrhythmia by decreasing blood pressure and reducing heart rate. Atenolol and bisoprolol are other prototypes of beta blockers that has less effect on the respiratory system, unlike other beta blockers such as propranolol. Implications: patients under beta blocker maintenance should be monitored before they get anesthetized with vasopressor formulations. These are drugs that constrict the blood vessels. The intake of non-steroidal anti-inflammatory drugs, or NSAIDs, should be taken not more than 5 days since they are known to decrease the effectiveness of beta blockers among patients. Calcium channel blockers are drugs that often end with the suffix dipine. Exceptions apply to the drugs under calcium channel blockers, which are verapamil and diltiazem. These drugs control calcium ions that are responsible for the contraction of muscle cells. Widely used calcium channel blockers are amlodipine, diltiazem, isradipine, and nifedipine. These drugs are given to patients with angina, hypertension, and atrial arrhythmia. Implications: patients that are being treated with verapamil and diltiazem will experience a longer effect of sedation if administered with benzodiazepines. Cardiac toxicity is also expected when prescribed antibiotics under the macrolide family. Antihypertensive drugs. They are prescribed to patients to normalize cardiac cycles by acting upon specific receptors. Class 1. Sodium channel blockade. Sodium channel blockades are used to control sodium ions from entering the cell membrane. Medications such as quinidine and procainamide are known to cause delays in repolarization. Lidocaine and phenytoin are used to shorten repolarization. We also have flecainide and encainide that may affect repolarization but not in a greater level. Repolarization is when the potassium ions are permitted to exit the cell membrane, making the cell negatively charged. Side effects of sodium channel blockades include fluid retention, constipation, vision problems, and tachycardia. Beta receptor blockades fall under class 2 medications under antihypertensive drugs. These decrease blood pressure by impeding the effect of epinephrine that causes high blood pressure. Diabetic patients are contraindicated for these drugs, including asthma and vascular diseases. Class 3 medications such as sotalol and amiodarone are known to prolong repolarization. Calcium channel blockades fall under class 4 of antihypertensive drugs. Samples of these are amlodipine and verapamil. They are known to cause decrease in blood pressure by immobilizing the effect of calcium in the heart. Contraindications of these drugs include a patient with hypotension, respiratory congestion, and myocardial infarction. Antiarrhythmic or diuretic drugs are drugs with the actone suffix. These drugs excrete solutes and fluids by increasing urine production. Thiazide diuretics, such as chlorothiazide, lead to mild diuresis because it keeps sodium and chloride from reabsorption. Undesirable effects include hyperglycemia, anuria, hypokalemia, hyponatremia, gastrointestinal distress, and weakness. Loop diuretics are similar to thiazides, but they are given in treatment for edema. They could cause dehydration among patients. Furosemide is a loop diuretic that is used for hypertensive emergencies. Adverse effect includes hypokalemia, or abnormally low potassium levels in the blood, hypotension, and hyperglycemia, or high blood sugar. The third loop diuretic is ethacrynic acid, which is similar to furosemide but is indicated for patients with edema. The fourth loop diuretic is torsemide, which is indicated for hypertension edema that may cause dizziness and headache. Lastly, bumetanide, which is a potent loop diuretic and it is used to treat pulmonary edema. The adverse effect of these drugs is hypokalemia, hypotension, and hyperglycemia. Potassium-sparing diuretics are used to treat edemas while it keeps the potassium in the blood. There are 3 drugs under potassium-sparing diuretics that are indicated for edemas. First is the spironolactone, which is an antagonist for aldosterone. It is indicated for congestive heart failure, hyperaldosteronism, which occurs when there's too much aldosterone in the blood. Adverse effects of these drugs include depletion of sodium and water, along with low levels of potassium. Second, we have the amiloride, which is taken with other diuretics and decreases potassium secretion with the sodium present in the blood. Adverse effect includes depleted sodium, water, and hyperkalemia. Third, we have the triamterene, which is prescribed with thiazides. It stops the reabsorption of sodium together with the secretion of potassium. The adverse effect of these drugs include depletion of sodium, depletion of water, hyperkalemia, and urination of blue fluids. Osmotic diuretics are medications that don't affect ion levels. Urine flow could either be normalized or increased upon taking mannitol. These drugs are indicated for brain edema and administered before glaucoma surgery to reduce intraocular pressure. Implications of diuretics. Non-steroidal anti-inflammatory drugs are prescribed not to be taken for more than 5 days because it will decrease the effectiveness of diuretics for hypertension. Antiadrenergic drugs constrict the blood vessels to increase blood pressure. They respond to the hormone norepinephrine. There are 4 types of antiadrenergic drugs. First, we have the alpha blockers that lowers blood pressure through vasodilation and increased renin secretion, which could result in peripheral edema. Second antiadrenergic drug are beta blockers, which as discussed earlier are effective treatments for angina and hypertension. Third are the alpha-2 adrenergic agonists. These drugs utilize alpha-2 cells from the sympathetic nervous system to normalize blood pressure. The fourth anti-adrenergic drug are monoamine depleting agents, which are drugs that impede the action of dopamine and norepinephrine to lower cardiac output and vasoconstriction, which will decrease blood pressure. Implications. Some patients manifest angina, bradycardia, peripheral edema, depression, and Parkinson-like syndrome with monoamine depleting agents. Vasodilators. These are given to patients with hypertension. They lower the blood pressure and reduce venous return. Venous return is defined as the pathway of blood from the periphery as it travels back to the heart. Reduction of venous return will decrease the cardiac output and will lessen the workload of the heart. Subclassifications of vasodilators, also known as RAAS or renin-angiotensin-aldosterone system, includes the ACE inhibitor, angiotensin II antagonist, and direct renin inhibitors. ACE inhibitors are drugs with the suffix "pril". They interfere the conversion of angiotensin I to angiotensin II. Since angiotensin II works to increase blood pressure, ACE inhibitors will cause vasodilation that will decrease the blood pressure. These drugs can cause persistent coughs. Direct vasodilators, such as nitroglycerin, relaxes smooth muscles. They are indicated for hypertensive crisis, hypertensive pulmonary edema, chronic heart failures, and angina pectoris. Another direct vasodilator is hydralazine, which decreases blood pressure and increases cardiac output. Unlike nitrates, these drugs are used for mild hypertension while it targets arterioles more than veins. Adverse effects of these drugs include tachycardia, fluid retention, and palpitation reflex. Calcium channel blockers are a group of drugs under direct vasodilator, and as discussed earlier, they inhibit calcium ions from causing contractions. Implications: patients are likely to have hypotension with their treatment. It can get worse if administered with mild to strong sedatives, CNS depressants, and vasodilator drugs. The intake of NSAIDs must be limited to 5 days because this anti-inflammatory drug will hinder the effectiveness of their hypertension treatment. Anti-hyperlipidemic agents are used to treat atherosclerotic cardiovascular disease that occurs when cholesterol hardens within the arteries, making it difficult for the blood to flow. Agents under anti-hyperlipidemic include niacin, bile acid binding resins, and statins. Statins are prescribed to decrease levels of lipids that could lead to heart disease. While bad cholesterol can be lessened with lifestyle changes, results may be gradual. But with the help of medications such as statins, taken as a maintenance drug, levels of bad cholesterol will effectively decrease. Implications: patients with maintenance drugs are contraindicated to erythromycin and ketoconazole. Antithrombotic drugs are used to inhibit clot formation. Patients need these drugs to treat arterial thrombogenesis. Although aspirins are not exactly used for platelet aggregation, they are effective antiplatelets. Implications for aspirins: patients taking aspirin on a daily basis are not contraindicated to minor dental procedures unless extensive surgery will be executed. Another thing is these antithrombotic drugs don't get along with NSAIDs since they could cause bleeding in the gastrointestinal tract. Anticoagulants are yet another group of antithrombotic drugs that end with the suffix "arin". Drugs such as warfarin and heparin are classified under anticoagulants. They prolong the clotting time by inhibiting the effect of vitamin K in the liver, where prothrombin originates and contributes to the clot formation. Implications for anticoagulants include gastrointestinal bleeding when they are prescribed with NSAIDs. Patients undergoing blood therapy should avoid macrolide derivatives, tetracycline, and metronidazole.